Hello, this is Dr. Grande. Today's question asks if I can describe the loneliness aspect we see with borderline personality disorder. If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about loneliness and borderline personality disorder, we're talking about an experience that is fairly common for individuals with that diagnosis. There was a study in 2016 by Liebke and colleagues that looked at this issue of loneliness and borderline personality disorder using 40 individuals who were diagnosed with borderline personality disorder and 40 individuals who were not, and comparing them across a few different measures. Now, in terms of loneliness and the definition of borderline personality disorder, the symptom criteria in the Diagnostic and Statistical Manual, we won't see any symptom criteria that use the word loneliness, but rather we see a symptom criterion that says a chronic feeling of emptiness, and usually that's the one we tie to this sense of loneliness, and sometimes we also tie in the fear of abandonment with this construct. Now, speaking of this construct, loneliness is really about a perception of social isolation and a feeling of being alone. But social isolation is a lack of interpersonal relationships. So social isolation and loneliness aren't exactly the same thing. One can be lonely without being socially isolated, but usually we do think of the two as strongly associated. Another way we can think of loneliness is that it's a perception of a difference between how many relationships somebody actually has and how many relationships that they desire. We could also look at it in a similar way, that it's about the quality as well as the quantity of relationships, again, actual compared to the desired. Loneliness is a construct that's associated with borderline personality disorder. Individuals with borderline personality disorder tend to report higher levels of loneliness and social isolation. And loneliness has some severe consequences, whether it's associated with borderline personality disorder or not, including higher morbidity with both mental and physical illnesses and higher mortality. Individuals with borderline personality disorder report smaller social networks, so they have regular contact with a smaller number of people, and we think this contributes to the loneliness. We also believe that the diversity level of the social network plays a part. Individuals with borderline personality disorder tend to have less diversity in their social network. So a social network, as I'm using it here, means the number of social domains represented across one's relationships. So for example, some domains would be coworkers, friends, parents, children, a spouse, neighbors, classmates, members of certain types of groups, for example, those with certain religious affiliations. So individuals with borderline personality disorder tend to have fewer domains represented in their social network. Now, in terms of these domains, interestingly, individuals with borderline personality disorder have a higher probability of being unemployed and living alone. So those are two domains where they would not tend to have relationships. But the loss of those two social domains is not linked to more loneliness and borderline personality disorder, a bit of an unexpected finding. So we believe that the social domains still play a part in loneliness, but maybe not as large a part as one would think. There's a theory about borderline personality disorder and this loneliness construct that goes something like this. Individuals with borderline personality disorder have characteristics such that they have a limited number of people that they can talk to. So there's this idea of a limited availability, and that's what causes the loneliness. But interestingly, this study suggests that there are impaired communication skills that cause this perception of a lack of number of people to talk to. So individuals with borderline personality disorder generally do have the same number of people available to talk to, but this impaired communication ability gets in the way. So really that's what's leading to some of the problems with loneliness, more so than the number of people available to talk to. So as we look at the results of the study, factors that could contribute to more loneliness with borderline personality disorder would be having contact, regular contact with a small number of people, having limited social domains being represented, but again, it's not really clear there, and having impaired communication skills. We have to be a little careful, though, interpreting these results because of the nature of the study. This did not explain much of the loneliness. There are other important factors that are still out there that were not identified. So a lot of variance in that loneliness construct was not explained by these different factors. Also, this study was correlational and didn't really study causation. We cannot randomly assign individuals to a borderline personality disorder group. When individuals come into research studies, they either have borderline personality disorder or they don't. So no random assignment can take place. So we look at this evidence and we think, well, borderline personality disorder must lead to impaired communication skills. It must lead to limited social domains and to a lower number of people with whom someone has regular contact. But actually, all those factors could lead to borderline personality disorder. We really don't know. We can't infer causation. It's likely, however, that the causation is complex, that certain factors point toward borderline personality disorder, and those symptoms of borderline personality disorder point toward other factors. So this type of idea of loneliness and borderline personality disorder, really this whole construct needs more research. Still, this particular study does give us a lot of valuable information about the relationship between loneliness and borderline personality disorder. And when we're looking at something like treatment planning, it's important to keep in mind the factor of loneliness and how that can affect treatment, and what we need to do to make sure that that's entered as a goal of treatment if that's what the client wants. I hope you found this description of borderline personality disorder and loneliness to be interesting. Thanks for watching.